Hospitals across the country, including right here in West Michigan, waiting their turn to receive the first doses of the Pfizer vaccine. Joining us to talk about their plan and the potential side effects of that vaccine is Dr. Andrew Jameson, Medical Director of Infection Prevention and Control at Mercy Health. Good morning, sir.
Good morning.
Yes, all right, let's dive right into it. Tell us a little bit about what we can expect when it comes to the timeline of receiving the vaccine and when the general public can receive their first dose.
Yeah, for us, we're actually in the waiting game still, too. We've been told that we're going to be getting it either yesterday, today, or tomorrow. And we've gotten some emails from Pfizer saying your package is getting shipped soon, but they have not actually arrived on our doorstep. We are actually ready to go within a few hours of receiving the vaccine, and we have people staffing all of our clinics and vaccination efforts already, even if we don't have it yet. In terms of when the general public is going to get it, it really depends on how fast that gets manufactured and when we get through kind of the first few waves of vaccination.
Okay, most definitely. So what does the timeline look like? You receive that, and then first in line is going to be healthcare workers, then the elderly, and then the general populace?
Yeah, we are getting definitely not as much as we need to do the entire healthcare provider pool for our whole organization in the first allocation. We are going to be targeting the people that care for COVID every day first. And so that's going to be those individuals that are doing this every day, all day, and we're taking care of them first, and then we're going to rapidly expand it out. There will be some overlap as we finish up our healthcare providers and go to those people that are highest risk for complications and start working down the priority list. So we think there's going to be a little bit of overlap, and we're really planning on trying to do this as quick as possible.
Most definitely. What kind of shipment are you expecting to receive? How many vials, how many vaccines, I guess, are going to be sent to you and your health department?
Yeah, they come in a package of 975 per sheet, they're called, and that's our initial allocation, and we're expecting to get another allocation shipped every Monday is what the plan is. So our initial allocation is 975 that we are expecting anytime today or anytime tomorrow that we can get going on. And then after that, it's actually still unclear how many we're going to get every week, and that's why it's really hard to give definitives about when we're going to start rolling it out widely.
Yeah, most definitely. Now, what's your personal take on the vaccine? Do you think people should get the vaccine, and why?
You know, I think that the biggest thing that tells me that we should get it is actually the transparency that's been part of the process. We've had more data about this vaccine than almost any other process for vaccination in the past. I've been able to review the data. I've been able to review all of the exact things that have happened to almost every patient during the trial, and I'm really reassured. Personally, I'm getting the vaccine, and I'm getting in line when it's my turn.
Okay, well, thank you very much for that insight. Side effects is something that we've been talking about, very limited information on that. Can you kind of expand on that for us?
You know, the good news is the severe side effects and the things that we kind of hear about from vaccines and the long-lasting side effects, we are not anticipating those. Side effects that last a day or two are definitely real, though. So we're seeing things like fever, pain at the site of injection, fatigue, and headache. Those are kind of your top four, and those are definitely real, and they happen. But I think it's really, really important to be transparent about that and talk about it and have people anticipate it. Really, it's your immune system kind of responding to the vaccine in a positive way, so it can be ready to fight off COVID if it ever sees it.
You know, Dr. Pfizer's already on the front lines right now. Moderna's possibly next in line waiting for emergency use. What's the difference between the two vaccines, and how do they work?
So the vaccines are not very different. So they're both called messenger RNA vaccines. And actually, one of the things that gives me most reassurance is that these were two different vaccine companies that didn't collaborate, that had a very similar product in terms of how they worked, and the efficacy data is nearly identical. So that gives us kind of a check and balance to say that actually is real data that is super exciting. And we're looking at a 95% efficacy rate for those. How they work is actually just a tiny bit of genetic information that gets injected into your cell. Your muscles take up that genetic information. It never reaches your nucleus or your DNA, but it just basically goes through the infrastructure of your cell, making a protein that your body responds to. So you don't get injected with any part of the coronavirus. You don't get injected with anything that is live or can actually get you infected. You're just getting injected with a little piece of genetic material that your body uses every day, and then it produces that protein. And then as soon as it sees it, uses it, it actually destroys it, which is really elegant and impressive.
Most definitely. Now, is this something that expecting mothers or current mothers should be kind of leery about? We understand that people who may have some sort of an allergic reaction should kind of be cautious before proceeding. Is this something that mothers or expecting mothers should also do?
You know, this is one of those areas that we're not 100% certain on. So the biggest reason we don't know for pregnancy or breastfeeding is that they weren't included in the study themselves. That's actually not unusual. Very few new drugs or new vaccines actually include pregnancy or breastfeeding in that protocol. Interestingly, the American College of Obstetricians and Gynecologists, as well as the American Society for Maternal-Fetal Medicine, both came out and said that this mechanism is something that is extremely safe for breastfeeding and pregnancy, and we think pregnancy should be prioritized. The FDA's statement on pregnancy was saying that they should just contact their OBGYN and have a real conversation about risks and benefits. We are not going to be making pregnancy or breastfeeding a contraindication to get the vaccine. So at this point, we're expecting to move forward and we're optimistic about the protection it'll provide. In terms of the allergy question, that is really early. So that is a new thing that came up kind of last minute coming out of the UK, because there were a couple individuals that had a reaction within minutes of getting the vaccine. We still don't know exactly if this was a real anaphylaxis, but it was enough to give us pause. And so one of the things we're doing is actually asking people who have had reactions to things that are injected into them previously to hold off for now. But otherwise, people that have bad allergies to foods or environmental allergies, those are not reasons to not get vaccinated. We do ask people to get watched a little while after that, because these reactions happen really, really early. And we're giving our healthcare providers that are doing the vaccine a lot of training on this so they can be ready to respond. One of the things that's a problem with a transparent process is you get this type of information really early. And when you have two people that respond in tens of thousands that have already gotten vaccinated, it's hard to know how prevalent it's going to be. And so we're really going to get more of that information over the next few months.
Dr. Andrew Jamieson with Mercy Health, a very informative interview. Thank you so much for your time.